Hello, I'm Lisa Martin from the HORIBA Veterinary team, and I'm delighted to welcome you to our next Continuing Professional Development webinar. We'll shortly be hearing from Conor O'Halloran, a practicing veterinary surgeon with a passion for internal medicine and infectious diseases. Following the success of our previous CPD webinar on raw feeding and the control of endoparasites in pets with Ian Wright, by popular demand, HORIBA are very pleased to follow up with Raw Feeding Part 2, Bacteriological Risks and Benefits in Companion Animals. I'd like to give you a brief introduction to our speaker, Conor, and to the HORIBA group. Conor was recommended as a speaker by Ian Wright and is very well placed to give us the benefit of his experience and knowledge. Originally from Cumbria in the north of England, he qualified from Liverpool University in 2015. Since then, he's undertaken both an MSc and then a PhD at the University of Edinburgh, studying and carrying out research into a variety of infectious diseases of dogs and cats, but his PhD thesis focused on mycobacterial diseases of companion animals in particular. Conor really enjoys the daily variety of general practice, but has a particular love of internal medicine and of course the infectious diseases, which continue to be an area of ongoing active clinical research. Feeding your pet is one of the most basic tasks in their day-to-day care, but it's easy to underestimate what an impact it can have on their health and well-being. It's entirely a matter of personal choice what an owner feeds their pet, but it's certainly a topic which prompts discussion amongst both veterinary staff and with pet owners. We know that feeding more unprocessed products has become increasingly popular, and whilst ready-prepared pet foods are produced in a highly controlled environment, it doesn't mean that there might not be any bacterial risk when using them. Conor's presentation will enable us to help those keeping pets and those working with them safe by making well-informed choices. HORIBA Veterinary are a well-established provider of in-house veterinary laboratory diagnostic instruments across small animal, equine and farm practice. We work with veterinary reference laboratories, educational settings and referral and general veterinary practices. Our product range includes handheld meters running single parameter tests, high capacity automated systems and the first fully integrated in-house PCR testing system. Here's a brief introduction. Our LacquaTwin handheld range works in seconds, including tests for metabolites and electrolytes. They can be used patient-side. Our unique ionised calcium meter aids in the detection of subclinical hypocalcemia, especially useful in dairy cattle. Using just a drop of blood, this test can enable early intervention for better post-calving recovery, better milk yield, and can even help to improve future fertility. We offer a wet clinical chemistry testing system with our Pentra PC400 to give reference laboratory quality results. The PC400 features integrated refrigeration and capacity for 55 onboard assays for day-to-day testing and beyond. This can include electrolytes, inflammatory markers and acute phase proteins. The Pocket Central PCR Analyzer is a neat benchtop instrument which even the smallest veterinary laboratory can accommodate. All steps of the PCR process are fully automated and can be run by any trained member of the practice team. After inserting your sample cartridge and reagent, the Pocket will present your PCR test outcome just 85 minutes later. No waiting for a lab pickup or for your test results to be sent through. The Pocket Central test range includes over 190 different assays for all walks of veterinary life, including small animal, farm, equine, poultry and aquaculture work. It can bring fast and easy PCR testing into your practice for parasites and organisms including viruses, bacteria and protozoa. Figures show that up to 10% of dogs and 4% of cats are being actively fed a raw diet by their owners. We also know that pets are very happy to supplement their meals with other things they may come across or catch outside of the home. Pets such as ferrets, snakes and reptiles may well also have a raw meat component to their diet. By using the right approach to feeding, any risk of parasites and pathogens to those animals and the people around them can be minimised. Please note that we're covering bacteriological risks and benefits of raw feeding in companion animals today, and neither Conor or the HORIBA team are able to advise or comment on the nutritional aspects of raw diets. If you have any questions for Conor or the HORIBA staff on their products, we will have a Q&A session at the end of the webinar. Please write your query into the Q&A box on the screen, and we will cover as many questions as possible at the end of the talk. We don't routinely issue CPD certificates. However, if you would like a certificate of attendance, please ensure you give us your details via the Q&A box, and we will email out a certificate in the next few days. You'll also have our contact details just in case any queries spring to mind after the event. The webinar will be available to view via the HORIBA website, and you'll be sent details of how to access the recording. So now I'd like to hand over to Conor O'Halloran to talk about bacteriological risks and benefits of raw feeding in companion animals.
Hello everybody, I hope that you can hear me okay and that you can see the screen. So as Lisa said, today the plan is to talk about raw feeding, and it follows on from the previous seminar that was given about parasitic infections that can occur from raw feeding. So we're going to look today at the bacteriological risks and potentially also some of the benefits that people find in feeding their companion animals a raw diet. So I thought we'd start by talking about what we actually mean when we say feeding a raw diet and to companion animals, and just briefly introduce what we're going to discuss today, because I appreciate that it's quite late for everyone and they've probably had a busy day. So we're kind of limiting it to companion animals, meaning dogs and cats. So as Lisa said, there are some animals kept as pets that will be fed raw components of their diet, such as reptiles and snakes and things, which is going to be part of a different sort of conversation, really. So the real focus is on cats and dogs. And the definition of raw food was sort of given initially the name of raw meat and bone diet by Marge Chandler, who's quite a well-known nutritionist. And it's defined by the Raw Feeding Veterinary Group as a fresh frozen diet. So essentially what we're talking about is meat that's minimally processed. So typically this is meat that would be considered fit for human consumption. So either it's genuine meat for human consumption that's been put into dog food, or potentially byproducts of animals at abattoirs that are not fit for, well, that are not used for human consumption, but would be considered fit. So for example, melanotic livers that would get classed as an animal byproduct because people wouldn't want to eat them, but there's no actual safety reason why you shouldn't eat them. And these standards are quite highly regulated in the UK and across the EU to make sure that basically the meat and the food that is going into these raw processed diets, especially for commercially produced diets, is of high grade quality and doesn't contain, as far as visibly in an abattoir is concerned, lesions or overt disease in the animal that's been slaughtered. The only processing that it happens is mincing and freezing. So from a bacteriological perspective, by mincing food, what we're talking about as a risk base is that anything that's on the surface of that meat is going to be minced and mixed right through the whole product. So it's not just going to be like your fillet steak that you can flash fry on the outside and it's going to stay sterile on the inside. Anything that's on the outside is going to be put right through the whole product. And freezing is pretty much the only way that they're preserved. So they're often bought by clients frozen in packs and then defrosted immediately before being fed to the pet. And in terms of some of the pathogens that we're going to talk about, that's of varying significance. So when it came to the sort of macro parasites, as we call them, the tapeworms and things, we know that freezing, as long as you freeze it for long enough and at a low enough temperature, you can pretty much eliminate most parasites, but that's not necessarily true for all of the bacteria that we're going to talk about today. But I thought that the first thing I would do is just to sort of show how much raw feeding there is. And it's interesting that there's actually very little systematic data out there on how many people are feeding pets raw food. And a lot of the data that we do have comes from surveys that are done in individual countries, and they're not necessarily systematically conducted. So, for example, you see there might be papers that show 80% of dogs are fed a raw component to their diet. But when you look at the actual methods of the paper, the survey has been sent to members of Facebook groups who are raw feeding activists. So obviously you would expect a really high return on that percentage. So actually, in GP practice, like most of us are, we don't really have any good data. What we do know is the number of publications that are rising around this topic has increased dramatically. So as you can see, this was just a brief search that I did the other day, putting this talk together. And this is just the number of documents in a Scopus database search, just looking for raw feeding pets. And you can see that there's been a massive trend upwards, particularly since sort of the early and mid 2000s, the last 15 years, and it's shot up particularly in the last 3 or 4 years as well. And we see that from sales figures. So outlets like Pets at Home, for example, show massive increases in their sales related to raw products. And we know that there's been a kind of in that one study that did try and do a sort of longitudinal study, there was, in 10 years, there was a 4-fold increase. So it's definitely something that people are doing often, and it's something that people are doing more often than they used to. And it's definitely something that I see as in general practice, and I'm guessing that a lot of the attendees will as well see more and more of in general practice. People asking questions about it, people getting puppies and kittens that are on raw diets and already, and you get asked the question, should I keep them on it, should I not? And so it's important to kind of know the risks and benefits so you can have that sort of discussion with the client. So I thought I'd start with the good and talk about some of the sort of benefits of raw food diets. A lot of the papers, and there aren't that many, relate to dogs. We have quite little data on cats. A lot of the benefits are given a sort of anecdotal credence, if that makes sense. So a lot of articles are written as opinion pieces, and there's actually, in terms of published literature that's been peer reviewed, there's sort of very little evidence to suggest one way or the other about some of these benefits. So, for example, there was a paper by Freeman in 2013 that was looking at the carbohydrate content of pet foods, and the idea being that a lot of proponents of raw feeding suggest that the dog has evolved from the wolf into the domestic dog, and therefore it's the most appropriate diet for a dog is as close to a natural wolf's diet as possible. And we know that wolves are not able to produce the enzymes required to digest a lot of carbohydrates. And this is where a lot of this sort of grain-free diet movements have come from, and that dogs are somehow intolerant to carbohydrates. However, we do know that actually that's a limit to that. So dogs can metabolize carbohydrates. They've evolved enzymes to be able to do that. They can break down starches. So there was actually no difference in the health of dogs that were fed carbohydrates versus not carbohydrates. And so it's a bit difficult to say whether that is a benefit or not to the dog in terms of their overall health. It definitely does increase fecal microbial microbiome diversity. Sorry, I'll get my words out. So dogs that are fed a raw diet have a more diverse intestinal microbiome than dogs that are fed just on a standardized commercial kibble diet. And that's led some people to think that those dogs might be healthier. So we know for dogs, for example, with chronic enteropathies, that actually fecally transplanting the microbiota from healthy dogs into those dogs with chronic enteropathy can kind of reset the whole inflammatory system and in effect cure some of those dogs. And therefore, there's a theory that the microbiome increase in the diversity can actually help with that. But in this study that looked at it, they only had dogs that were healthy. So they didn't include dogs that had chronic enteropathies, and they didn't include any unhealthy dogs with any other diseases. They literally had just dogs fed one diet or the other, and all dogs were healthy at all time points. So it was quite hard to say whether there was an impact of that microbiome diversity on the overall health of the dog. Quite a lot of studies report that dogs have better stool quality from raw food, probably because of feeding them raw bones and the calcium dries out the feces, and so they have a sort of firmer stool. But whether that's actually, again, a healthier thing for the dog wasn't really shown. A study by Glasgow in 2002 fed cats and kittens on a rabbit-based diet, so it was a raw rabbit-based diet, and they showed no adverse effect in the growth rates between the two groups of kittens and no adverse effect in the cats. So the kittens grew at the same rate, whether they were fed raw food, rabbit-based raw food, or whether they were fed on a kibble-based diet. So there was no overall benefit of the raw diet, but also there was no benefit, there was no detriment either. Now, interestingly, on the right-hand side, we've had some more recent studies that have looked at sort of the anti-inflammatory effect. So there's a lot of anecdotal reports that you suddenly will get. You can treat dogs that have chronic inflammatory conditions like atopic dermatitis by feeding a raw diet. And certainly probably quite a lot of you in practice will have had clients who have an atopic dog and they go online and they find out information about diets. And what's not clear is how much of that response is because actually the protein source is a novel protein, which would be part of your kind of standard treatment for an atopic dog anyway, and how much of it is actually down to the fact that there's no additives or preservatives or anything that might give the dog an antigen to react to. And there was a study that looked at the inflammatory cell markers. So what they did was they took the white blood cells from dogs that were fed on raw meat diets and dogs that were fed on dry kibble diets. And they showed that the gene expression of pro-inflammatory gene markers was lower in the raw-fed dogs than the kibble-fed dogs, and therefore they suggested that that might indicate that the raw diets were having an anti-inflammatory effect. But the limitation of the study was that they didn't actually measure in the blood the amount of those pro-inflammatory markers that were being produced. So we know that cells will produce a lot of genes that are never actually expressed as proteins and never actually make it into the body. So they never measured how much of those pro-inflammatory or anti-inflammatory markers were in the blood of these dogs. And again, the dogs were clinically all healthy at the time, so they weren't able to suggest whether or not it was having a clinical effect. It was just a physiological difference that may or may not manifest in a raw-based diet. And then the final one that you will hear quite a lot is that it's better for their teeth. And we know that, cats, especially that hunt, which is obviously a form of raw feeding in and of itself, do tend to have better dental health as they get older than cats that are fed, for example, a wet commercial diet. Interestingly, although a lot of people and clinicians would agree with that and say that they see that on a day-to-day basis, there's actually no real published or peer-reviewed evidence to support that. There's a lot of evidence from zoo animals, so large cats, lion, tigers, those kind of things. They're fed raw usually as part of an enrichment program, and in the zoo setting, and we have evidence that for those big cats that their dental health is better if they're given bones as part of their diet than if they're just given the meat part of their diet. But those same studies haven't yet been done in the domestic cat. But I think there's quite a lot of anecdotal evidence, and there's a good theory to think that actually they probably are helpful to their overall dental health. But it's interesting that there's actually such a limit on what we know of the benefits of raw feeding, and a lot of it's still very inconclusive. So at the moment, it's still quite hard to sort of be able to sit down with somebody and say these are the definite benefits of raw feeding, because there's a lot of theory still, and there's a lot of work going on, particularly in Australia. There's certain research groups that are really pushing to try and get the data together and get it published to show that these things actually have a clinical effect. But at the moment, we're still sort of lagging behind that. Whereas I think there's probably, because the risks are kind of much more severe when they happen, there's a lot of more publications at the moment about the risks rather than the benefits. But that data may come in the future, and it may come soon, but it's just not quite there at the moment. So like I said, there's a lot more publications at the moment about the microbiological risks, and particularly bacterial risks from these diets. And if there's one reference that people have access to, and your BSAVA members, this review by Davies and others is a really, really good resource. They cover absolutely everything. They cover bacteria, but also parasites. It's quite a short review. It's very well written. It's very understandable. So if anyone goes away from this talk and wants to find out some more in-depth information, and you're a BSAVA member, you'll find this on their library. If you don't have it, MRCVS Knowledge, you can sign up to their library and have access to publications and find it that way, or contact the authors, because they'll probably quite happily share their findings with you. And it's a really good overall review, and it was done only a couple of years ago, so it's probably the most up-to-date review that we've got. So based on that, and based on a lot of the publications that exist out there, the main risks that we're kind of going to go through today are probably things that you guys already are aware of, and probably if I asked you to write a list of risks, most of these would probably already be on your radar anyway, but we'll just go through them specifically. So salmonellas, E. coli, Campylobacter, Listeria, Yersinia, Brucella. So not to be confused with Brucella canis. So the sort of attention at the moment that's being brought on Brucella canis from imported dogs, particularly from Eastern European countries and Romania. It's not the same Brucella, it's a different Brucella. So that risk is completely different. So we're not going to talk about that today. That's a whole different story. And then the sort of miscellaneous ones that occasionally crop up. So Staph aureus, Clostridial diseases, and then of course I had to get mycobacterial diseases in there somewhere. So we're going to mention Mycobacterium bovis and TB as well. And so to start off with salmonella. So salmonella is probably the most commonly isolated organism from raw food products. And it, depending on the study that you look at, the percentage of contaminated products is quite variable. Often depends on the country. So in the US, they have quite a significant problem. EU regulations on food handling mean that we have less of an issue, but up to sort of, even in the UK, up to 20% of samples are positive. And what's been quite concerning recently is that reportable serovar infections, so these are subtypes of salmonella which can cause serious health issues in humans, and salmonellosis and disease, and are, once you've identified them, are reportable to APHA. In recent years, more than 50% of cases have been associated with animal feed. And don't forget that there'll be a lot of cases where the source of infection is not identified. So some of those may well be from animals and animal feed. So it may well actually be higher. Now, it's important to say that by animal feed, that's not all raw food for cats and dogs. Some of that will also be from unwashed vegetables that cows have weed on and things like that. So, but it's just an important pathogen to be aware of, and there has been a lot of studies that show strong positive correlation of shedding Salmonella species by dogs, particularly dogs that are fed raw diets. Now, the interesting thing is that cats, there's a lot less literature about cats shedding Salmonella. So there's a single case report of a cat that was died of septic salmonellosis that was associated with its raw food diet. And it's only a single case report in the literature. And I suspect personally, and this is hypothesis really, that a lot of the times that we talk about these problems is when we have cross-infection of serovars. So what I mean by that is animals, including humans, dogs, cats, we have evolved to eat certain diets, and we've co-evolved with the pathogens of those diets. So, for example, Salmonella is usually a poultry problem. So it's on contaminated poultry products. Cats eat a lot of birds. Cats will hunt wild birds. We know that occasionally we see a cat with songbird fever that's because of salmonellosis, but actually cats have probably co-evolved with Salmonella strains for quite a long time in their evolutionary history. And so they probably have quite a tolerance for exposure to Salmonella. That means that even if it is in their food, that they're probably not going to get sick. Whereas dogs are scavengers naturally, and they probably have, again, a tolerance to certain serovars. But what happens is we get cross-contamination of serovars to either strains that the dogs are not evolved with or ones that humans have not evolved with. And when you get the species crossover, that's when you have problems. So, for example, you get pig strains of Salmonella in pork products that dogs are not used to and haven't been exposed to previously. And that's when you get clinical disease, either in the dog, or you get shedding from the dog that causes clinical disease in a person if they're exposed. So a lot of the raw feeding, and we'll come on to later, of how to do it properly, is based around good hygiene measures to prevent this cross-contamination. So some pictures here: hand washing, handling the feces of dogs, dogs licking people's faces, how you feed the animals. But it's also about thinking about what would naturally be in an animal's diet and trying to feed, as the Raw Veterinary Raw Feeding Society say, a biologically appropriate food for that species. So a similar thing happens with E. coli. So E. coli species have been found again in really high numbers of some samples in studies. And what's quite concerning is that what's been found recently is that some of these species of E. coli are antibiotic resistant. And this is one of the big problems that's emerging from research into raw feeding at the moment, is that not only are they quite high levels of contamination, and again, strains that are dangerous to people. So these may not be strains that are particularly dangerous to the pet. They might be, but they are particularly dangerous strains to people, such as E. coli 0157, which can cause really bad kidney disease in people, or sepsis. It's found up to 20% of raw food samples. So that's 1 in 5. And if people are feeding every single day, then at some point they're going to come across a contaminated sample. And there was actually, sadly, a human fatality in the UK associated with one of these crossover species. And there was an E. coli 0157, and it was in the dog's raw food, and it got affected the family, and sadly one of the family members actually died from renal failure because of it. So that is obviously a major concern in and of itself, but the fact that there's now more and more drug resistant strains being identified is a real concern, and we're not really sure at the moment where these strains are coming from. So is it part of antibiotic use on farms? But we know that our farm animal colleagues are really cutting down on the amount of antibiotics that they're using in farm animals, and the types of antibiotics that they're using are sort of much lower generation, and there's a lot of antibiotic resistant awareness on farms nowadays. And I think, you know, credit goes to farm colleagues or mixed practice colleagues, if there's any of you out there listening, for doing that, because, you know, that's a source of contamination for us and the environment and pets as well. So it's a bit of a conundrum at the moment where these cephalosporin, third generation cephalosporin resistant and multi-drug resistant strains are actually coming from, and how they're getting into the meat of our pets in the UK. And that was just last week that was published. So this is very much like a live issue, and we don't know a huge amount about it yet. But it's going to be a hot topic to kind of watch for as things progress, I think. And so I'm briefly going to mention these two pathogens because Campylobacter and Listeria are two, again, quite commonly associated with human disease. So we know, obviously, in the UK, Campylobacter jejuni is a massive problem at Christmas because people undercook their turkeys, and a similar thing can happen to our pet dogs that are fed sort of poultry products. However, both Campylobacter and Listeria are quite susceptible to freezing. So animals that have animal food that has been frozen for prolonged periods of time and at cold enough temperatures will massively reduce the amount of Campylobacter and Listeria that are there, if there is any there to start with. So although it has been isolated from raw pet foods, it's been quite rare. So there's only a single study that's found a significant amount of Campylobacter jejuni, which is the strain that causes disease in humans, from retail pet foods. And that was 5 years ago. And that finding hasn't been repeated in subsequent studies or in different countries since. And that's probably because Campylobacter is quite susceptible when it's frozen and thawed out. It doesn't survive very well. So as long as the meat is safe to start with, then by freezing it, you're reducing the risk even further. And the same with listeriosis. It's, again, not very tolerant to being frozen, but it is particularly happy to grow at a cold temperature. So the real risk from listeriosis is the fact that in a fridge temperature, it will grow like crazy, because that's its preferred niche, is to be around 4 degrees, which is where most people keep their domestic freezer at, fridge. So if people are defrosting their dog food in their own fridge, then any listeria that might be there has the chance to replicate and grow. And it does cause quite serious disease in people. As you can see there, the CDC report that it's one of the most common causes of food poisoning related deaths in the United States. And I couldn't actually find figures for the UK specifically that were very recent, but wouldn't surprise me if it was similar. And the particular risk, and this is sort of where we'll come on to a little bit in terms of who should be feeding raw diets to their pets and who shouldn't, particular risk to pregnant women, because listeriosis in pregnancy can cause miscarriage and can cause fetal abnormalities. And so it's really important that pregnant women in particular are not going near these foods. And as was touched on in the parasite lecture, there's also things like toxoplasmosis and other risks during pregnancy. So there are certain sort of risk factors that we'll look at later of, like, when people should really avoid feeding raw diets. But generally, these two are quite low down the list because of their intolerance to being frozen and the fact that most of these raw foods are frozen before they're fed to our pets. And of course, I couldn't not mention tuberculosis, because that's obviously what I managed to do my PhD on. So while I was doing my PhD, we had a problem with tuberculosis in cats, because it was traced to a venison product. And again, it's this evolutionary maladaptation. So what had happened was a deer strain of Mycobacterium bovis that was living quite happily in the deer with no lesions at an abattoir detected, because the deer has co-evolved with these particular serotype spoligotypes of Mycobacterium bovis. So the carcass was not found to have any abnormalities that, well, we assume at meat inspection in the abattoir. Parts of it, tonsils, lymph nodes that are not usually used for human consumption, ended up in cat food. And again, because of this mincing process, instead of kind of being limited to just one batch or one unit, the infection was spread through the whole batch that was produced, and it contaminated a whole series of products over quite a period of months. And so in the end, we ended up having clinical disease in about, well, just under 80 cats now. About 75 presented initially within the first 12-month period. But what's really quite interesting is that in people, TB has a latency period. So from the point of challenge and the point of infection, not everybody will develop clinical disease straight away. So a proportion will, and then a proportion will develop disease later on in life. And we're now seeing cases that go back to being fed the contaminated product in sort of 2018-19, and in 2022 are developing clinical disease. And so there still may be cases that crop up in the future, and we just don't know. So when we screened cats, we found that at least 200 or 300 cats had been exposed enough to have developed an immune response, but we don't know how many of those cats are going to potentially develop disease or go on to shed infection in the future, because we don't understand the dynamics of the disease when cats are infected by this route. And again, you'll hear me say it again and again, it's because it's not a normal route of exposure for cats. So we see TB due to M. bovis in cats all the time in clinical practice, and certainly I did during my PhD, got a lot of emails from probably some of you guys who saw cases in practice, and then they're usually very restricted lesions to the skin, and the immune system of the cat is very capable of dealing with and walling off those infections in granulomas that we can then remove and then treat the cat with drugs, and 90% of them will go on to live perfectly happy lives. When cats are challenged in an abnormal way with an abnormal strain, the disease rate was much more severe and the disease progressed much more quickly, and there's a lot fewer knowns and a lot more unknowns in terms of the risks of shedding to people, which makes our jobs quite difficult when we're trying to talk to people about what they should and shouldn't do when it comes to raw feeding. So I thought this would kind of be a helpful thing to just go over, is like, what should we do in practice? So I was just saying to Lisa earlier, this morning I had a client who has a puppy, and she's a German Shepherd, beautiful German Shepherd, 12 weeks old. She's just been to pick her up, and she has been given a bag of food, which the owner didn't even know what type of meat it was, but it's just literally a bag of raw meat, and said, this is what you need to feed your puppy now. And she comes in and says to you as the vet, or to me in this instance, this is what the breeder has put the dog on, this is what she said I should feed it. I've had lots of dogs in the past, I've always fed them conventional food. Should I actually be feeding them raw or not? And that will be a common question that you get. And you'll also get the flip side, which is people who are already feeding raw and are insistent that it's like the best thing ever for their dog, and there's absolutely no way they want to change. And even if you think it's not the best thing to do, they're absolutely adamant. And those are two extremes, and there will be people on every aspect of that spectrum. So I always find, and I think probably everyone would agree, that the trick really is to have a conversation and not an argument, because as soon as you start having an argument with somebody, you're not going to listen. They're not going to listen to you. They're not going to change their mind. So all we can do in practice is have that conversation about the risks and what the risks are. So you need to highlight the risks that are very real. So these outbreaks and infections do not happen very often. We know that. So the risks we're talking about are low, and advocates of raw feeding would say, you know, you're talking about the needle in the haystack, and you don't talk about the thousands of whatever dogs that are on these diets that never get sick. all you hear about is the cases where it goes wrong, and that is true. But I think the reason for that is that because when it goes wrong, it can go very wrong, and it can go very wrong very quickly. So I've had, in just general practice in the last 12 months, I've had clients hospitalized and their children hospitalized in separate incidents because of raw food related infections. So it is a very low risk, but it can be a severe risk when it happens. So in terms of risk management, people need to understand that, yes, it's not very likely, but if it does happen, it can be quite severe. And that's then their choice to accept that risk or not. It's the same as, you know, some people go skydiving and some people don't. And it's your attitude to risk that influences those decisions. If people are feeding raw, it's absolutely essential to emphasize good hygiene practices. So people have to wash their hands. People have to follow the instructions on the packets of the food and make sure that it's being kept at appropriate temperatures, that it's being treated properly, that they're not cross-contaminating with their own food in their own fridge or contaminating their own kitchen, and making sure that everything that the raw food touches gets washed thoroughly and at appropriate temperatures. So, for example, freezing food is not going to kill mycobacterial infections. Mycobacteria in the lab can survive down to -80 degrees and then grow quite happily as soon as it's thawed out. So your domestic freezer cannot get cold enough to kill some of these pathogens. So it means, but conversely, mycobacterium does not survive in heat particularly well. So if you put a dog's food bowl through a hot cycle of a dishwasher, you're going to disinfect it, and if there is any mycobacteria on there, they're not going to survive. So it's emphasizing these kind of hygiene practices to clients to make sure that they're aware and that they are doing things sort of as appropriately as they can. And definitely one of the top things for me is immunocompromised members of the household. So it is a completely different situation for me as a adult male in my 30s with no, thankfully, underlying health issues if I was to feed my cat a raw diet, because my exposure, should I get it, is probably means that I'm unlikely to get severe disease. If I do, I might get a bit of food poisoning for a couple of days, but I'm probably going to be okay. That's not the same risk as somebody who has severe underlying health issues. They're immunocompromised, they might be on chemotherapy or radiotherapy, they might have autoimmune conditions, and definitely pregnancy in terms of not just listeria but toxoplasmosis. So I would, although not strictly speaking immunocompromised, I would include pregnant people in that, and certainly households with children, because they're not going to be able to follow the hygiene practices as efficiently. Young children put everything in their mouths, and they're just, going to lick the dog's bowl. It's going to be much harder for people. So in those situations, it's definitely worth advising against, raw feeding. But if there's adults only household and everyone's immunocompetent and they're aware of hygiene practices, yeah, they probably can do it safely. And if they want to do it, then absolutely go for it. But you need to have that conversation about risk with them and let them make that decision without trying to push them one way or the other. I also find it's quite helpful to have a set of links and with good and reliable up-to-date information, so that if people are on the fence because they might have been told by the breeder that it's a good idea but they're not so sure, or they're on Facebook and Facebook says that they should do it but they've got immunocompromised and they don't think they should do it, there's actually some really good information that's quite objective, because as soon as you start referring to some of the more, shall we say, I don't know how to put this, there's quite a lot of extreme opinion about this topic, and so people will fall into echo chambers where they will only find information that reinforces their preconceived view, and we have to not fall into that trap as professionals. And so I find it quite helpful to have links to the Pet Food Manufacturers Association, that have all similar guidance to what we've been talking about today. They also have an accreditation. So there are pet food manufacturers who conform to best practice guidelines when producing the foods, which means that they follow best practice in terms of their processing and their hygiene and their disinfection of their manufacturing facilities. And so they actually are listed as accredited providers of raw food. So you can even suggest to people who are really wanting to try raw food or are already on raw food that maybe they should stick to a commercial accredited raw food provider that they know is going to provide them with as safe a product as possible. Still won't be 100% of the time, but it can be as safe as possible. And although we're not going to go into it today, but also some of the nutritional aspects of having a balanced diet and those sort of controls as well. So as a general practitioner, I think there are things that you can really think about. But there's definitely a wider question of what we do as a profession. So there's been a lot of research done about what people think of vets and what we tell them. And interestingly, the study that's mentioned there at the bottom found that basically owners already had made up their mind before they spoke to their vet about how they were going to feed their animal. And if you agreed with them, they thought you were knowledgeable, and if you didn't, then they thought you were not knowledgeable about nutrition. So we have a big problem in terms of trying to get people to be on our side and listen to us. And so some research that we've done at the University of Edinburgh and with vet professionals and Sarah Caney showed that when people are looking for information about how to feed their animals, when they were asked where they would seek to get information, 87% of respondents, and this was over nearly 2,000 respondents, 87% said that they would go to the internet before they would go anywhere else. Only 2% of respondents said that they would seek advice on nutrition from a veterinary professional, and in that we included both vets and veterinary nurses. So only 2% of pet owners actually think we're a good source of information about nutrition generally. So there's absolutely a big job to do in terms of trying to educate people that we know that what we're talking about, and to have that conversation with people. And I suppose the only caveat to this was a quote from Mike Davies that was just in terms of having those conversations, is that you do need to be cautious that you are being objective and evidence-based, and not, like I say, fall into the trap of the Facebook echo chambers, because if somebody follows your advice, then you are a prescribing vet, and in a sense you're potentially prescribing a diet like we would for chronic kidney disease or liver disease or chronic enteropathy. We would prescribe a hydrolyzed diet. So if we advise people that they should be feeding raw and then there is a problem, is there a potential comeback for that? And that's not been tested, and it's not been an issue that's arisen yet, but as a profession, I think it's something we need to think about, as well as how we actually get more owners to think about nutrition as a veterinary issue and sort of come to us for their advice and not believe everything they necessarily read on Facebook. So that was me, and I hope that covered everything that you were hoping for, and I hope there's some time for questions if anyone's got any.
Hi, thanks very much, Conor. This is Lisa Martin from HORIBA. Thank you
Hi again, Lisa.
Hiya, hi. Thank you to everybody who's joined us this evening. We've seen on the attendees list, we've got some vets, we've got some nurses, we've got some people working in the nutrition industry as well, which is always good to have those on board too. So I expect everybody's been working today. So thank you so much for joining us this evening. and I hope you found it useful so far. I know that I've got some copious notes here from tonight's presentation, which has been both useful and informative, and thank you to Conor for presenting such a balanced view to us, which was what we asked for. That the brief was to give us an overview of what we might be looking out for when it comes to raw feeding, and I think your summary with the good, the bad, and everything else worked very well. So thank you for presenting that. We already had a comment in from Libby Sheridan saying, terrific presentation, thank you very much. So that's high praise indeed. So thank you for that, Libby. So we will move on to some questions now. If anybody's got anything that they would like to pick Conor's brain about, then please pop it into the questions box that should be on your screen just now on the go-to dashboard there. So please pop those questions in. I know there are a couple of things that sprang to mind for me, which we'll come on to, but I just wanted to recap some of Conor's points there, which were around the evidence-based approach that you've mentioned. So you pointed us towards the resources from both the BSAVA library and also the RCVS library as well. So if you're not a member of BSAVA, obviously that may be a little bit more difficult for you to access. But I think having those resources at hand and being able to refer to them to back up anything that you might say to a client. Conor's touched very wisely on the fact that if you are a veterinary surgeon who is discussing diets, obviously this could be seen in the same light as if you're prescribing any other treatment, and there is a professional responsibility there. So having that evidence to back up what you're supporting is obviously a very helpful thing to do, and to have those resources at hand. I think one of the other things that he touched on that I found particularly useful as well was just talking about pre-prepared raw foods, or we will have clients as well who will choose to feed a more random mix, shall we say. So if somebody's feeding a prepared food, we talked about recalls. We know that there was the issue Conor touched on with the TB in cats. There was also there were also the salmonella cases that he reported. So if you're feeding a pre-prepared raw diet, there is the potential, if an issue is discovered with that particular brand, that it could be recalled, which obviously is the responsible thing for these manufacturers to do. There is perhaps more of a risk when your clients might be using a more home prepared diet, and we've probably all seen pictures of the bowls that have got an egg, some chicken, a rabbit's foot, an ear of something, some tripe maybe, which is less restricted, if you like, in how it's prepared. So those are the times when we need to be super careful as well. So thank you very much to Conor for the overview of the steps that we can take to help reduce bacteriological risks, such as freezing with some of the pathogens, but also the hygiene steps that can be taken as well. So a question that I had, which probably comes a little bit more around to disease testing. Obviously, HORIBA have an interest in this with our testing equipment. So we mentioned that you may pick up pathogens if you've seen that an animal has become ill, and you detect either by in-house testing or by sending out a disease such as salmonella. What are the steps that a practice should take, Conor, to report these diseases which need reporting?
Oh, I knew you were going to ask that question. So this is where it does get a little bit more difficult, because this is what I was saying about the fact that some of these strains and some of them will be natural commensal in our companion animal species. So a dog which is why we probably don't do like routine screening for these things. So a number of dogs will carry salmonella and salmonella subtypes anyway, most of which are not dangerous to the dog or to the human. So really they only get tested kind of when they're sick, so usually with gastrointestinal signs, and actually the labs will report. So generally if it's a culture, for example, of a fecal sample and a serovar is cultured by, I don't know, a big external laboratory, they will notify the local health authorities that they've isolated that serovar. It gets a bit tricky because some of these things, then the question becomes, are they commensal or are they causing disease?
Sure.
And that's always clinically quite a challenge to work out. So a dog with long-standing diarrhea, just because you happen to have a positive Campylobacter test of, then, is that causing disease or not? So generally dogs have, so Campylobacter upsaliensis is the commensal strain for a dog. That would be something that wouldn't necessarily, I mean, it could cause disease, and it probably does, but this is where it gets difficult, because Campylobacter as a species is too broad to say it's a problem.
Yes.
So that's where it sort of gets difficult to decide. So some things are just obligate pathogens, right? So for example, if you get a PCR of Mycobacterium bovis out of the skin of a cat's lesion, then that's causing the disease, and I can help you to treat that. That's definitely an obligate pathogen. So some of these infections are obligate disease causing pathogens, and some are opportunistic. And so the difficulty as clinicians is deciding if the disease if there is disease, then is it that you've accidentally found an opportunistic strain, or is it actually really pathogenic? So that's a little bit of a tricky question.
Sure. Okay. And I guess taking the whole clinical picture into account is key, isn't it? You're not going to just test in isolation. So
no. And actually, one of the recommendations, I mean, certainly like the ISFM Congress was last week, and for cats, they've updated their recommendations that actually, as part of every clinical examination of every cat, clinicians should be asking about a nutrition history, because it will help with the list of differentials for potentially, weight loss, parasites, all the things that you're talking about, testing that you guys can test for in-house and stuff like that. So actually, it should form part of your general history taking. What is your cat fed on? Does your cat hunt? Could it have had access to raw something or whatever? So they've actually updated their guidelines on best practice for the clinical exam of the cat recently. So yeah, we should probably we'll find more of these things as we progress, I think.
Absolutely, it's certainly an evolving field. As you said, we were speaking just before the webinar started about recent events and developments in diagnostics and treatments in all sorts of different things. So yeah, great hint on the ISFM resources as well. So thank you for that. And I appreciate the testing and reporting is a bit of a tricky area. But my understanding is that the APHA are the first port of call if you have a concern.
So usually at a laboratory, for example, like our practice is IDEX, for example.
Yeah.
We just are, and so they would report to APHA for you, and most of the time it's done for you. So same with like tuberculosis, people ring me in a panic saying, who do I need to notify? And but actually the diagnostic lab, whether it's BioBest for the IGRA test or wherever the PCR test, they probably notify APHA for you, and then APHA take it from there. So most of the time the notification is kind of done, or reporting is done at the laboratory level.
Excellent. So less of a worry for
yeah, don't panic people that you're going to get struck off for missing out on notifying somebody.
Absolutely. No, that's the last thing we want. We don't want to encourage people to diagnose these things more and then land them in hot water. That's the last thing in the world we want. So thank you for that useful information. So a question that's come in, what do you tell owners to feed supermarket or butcher raw meat? I'm assuming that this is over and above, a kind of a packaged raw diet. So Celine has sent that in. If I've misunderstood that, Celine, then please pop something else in the chat and clarify. But I think we're looking at meat, kind of human meat, as we might
Yeah,
classic.
yeah, and this is the question, right? And it's actually she's Selena's hit the nail on the head really, because um the it's all the risk is all to do with how it's been handled and how it's been processed and packaged. And so in a supermarket level, like if you go to, I don't know, whatever, one of the big four supermarkets, and you buy a chicken raw off the shelf, then you know that by definition it has had certain tests and has to be, below certain thresholds for infectious diseases, and they test for all sorts of Campylobacters and boom, 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 boom.
Yeah.
So you know that that is the case, and that's part of our food standards thing. But this is the difference between people doing what you were saying and doing the kind of homemade versions of diets, which I didn't really touch on because actually that comes more under the sort of nutritional balance thing, which I know we're not really talking about today. It's a whole different thing. But so the question I have with that sort of setup is, would you eat that chicken out of the packet as it is? And if you wouldn't, why would you risk putting it in your dog's food bowl? So if it's something like you go to the butcher so like personally, I have my steak incredibly rare and barely cook it and would probably eat it raw. So I would go to my butcher and I'd buy a steak and I'd barely cook it at all, but I cook a chicken because I cook it all the way through and make sure it's definitely dead before I eat it. Whereas, my friends joke at me, my friends in farm practice joke that I eat my steak at a point where they could probably sew it back onto the cow. So, that sort of thing, I think for me, that's the difference, because if you'd be happy to eat it, then why wouldn't you feed it to your dog? If you wouldn't eat it as it is, then maybe your dog shouldn't or cat shouldn't either. And that's the way I sort of divide it. And that may be completely, people can disagree with me on that, or till the cows come home. But as a general rule, that's kind of how I advise people about what, if they're going to feed on, even if they're adding raw meat onto a commercial kibble diet, because just to make it a bit more interesting for their pets, people say, that question, where do I get it from? What do I feed and stuff? And that's generally how I sort of answer that question.
Okay, thank you very much. And I think there is a differentiation there, isn't there, between the pre-prepared foods, and whilst we're not touching on the nutritional aspects of raw feeding, obviously it's important for anybody who's using or recommending a raw diet to make sure that that diet is balanced for the animal they're feeding it for and at their particular life stage as well, which is challenging, and the pet food manufacturers put in huge amounts of research into ensuring that every single piece of kibble is balanced, for the pet that they're targeting it at. So with a raw diet, this can be more of a challenge to ensure that the diet is particularly balanced, but it may be that you're using a really multifactorial approach to do that. And then you have to apply the same hygiene approaches to every single aspect of that piece of diet. So if you're using the chicken's feet or the piece of chicken or the rabbit's ears or the raw eggs, to ensure that every single piece of that, every component of that diet is treated with the same, hygiene aspects, whether that's around where you're preparing it, how you're preparing it, and what you're preparing it into, and the people around it as well. So thank you for that question, Celine.
Sorry to interrupt, that's why the Pet Food Manufacturers Association have a scheme for commercial raw food diets now. So they have to meet, they've recognized that this is a common thing. They've set out best practice guidelines, and they have approved certain manufacturers' brands of food for all of those reasons that include both infectious things and nutritional things as well. So, that would be a good place to kind of point people to as well, rather than, I think everybody agrees that it's incredibly hard to do a completely raw diet balanced on your own at home, just in your kitchen with what you've got in your fridge. It's, for various reasons. So definitely the sort of commercial way is better, because like you said, Lisa, as well, if there is a problem, because of the checks and balances, they get highlighted immediately, and like they do, but you get recalls and stuff with raw kibble food, cooked kibble food as well. So
Yeah.
there's been problems with wrong vitamin D levels in food that has had to be recalled, and problems with that, and then the pancytopenia scare that we had a while ago, and with cats and
Absolutely,
stuff.
yes.
So
Yeah.
it's cooked food it has problems as well, but the fact is that it's regulated so that problems are picked up, identified, and fixed, and that's where the Pet Food Manufacturers Association is moving with the raw food as well, is to increase the safety to as high a level as possible.
Absolutely, and you've kind of stolen my line there, if you like, Conor, because I mean, it's a great thing that we're both on the same wavelength with it, because just to touch back that even with the pre-prepared foods as well, that there can be issues with things, and the pancytopenia cases that we saw, I think that was last year now.
Just to go, they could
who knows?
Who knows?
But one of the benefits of using a pre-prepared diet, whether that's a kibble, whether it's a raw diet, is the traceability. So should there be an issue, it's much easier to be able to track that back, and to see where that might have come from, and to be able to act accordingly. And if you do have anybody who's still with us, any anecdotes, any feedback about kibble feeding, about raw feeding, now is a very good place to to be able to discuss them. And if there are any more questions, we've had some more come in, then please pop them into the chat just now, into the questions box. A couple of requests for certificates of attendance, so yes, absolutely, we will get those out. They'll come to your email address in the next few days. A question from Daryl: what's the difference bacteria-wise between homemade raw, butcher type, and store-bought frozen raw? Is one better for the other than for the amount of bacteria found? So I think we've probably touched on that mostly. One thing I did want to ask as well, Conor, was you mentioned about putting the bowl and the utensils in the dishwasher, which was an adequate way of sterilising, if you like, or minimising bacterial risk. So if we are using our home kitchen area, which most people will be doing with pets, is the dishwasher and the washing up bowl the right place to be doing that, or should we be taking extra precautions?
Well, actually, so that's a really good point. So most people will be using their own kitchen as where they feed their dogs, right? And so you see a similar issue with like sort of toxoplasmosis, because I'm sure Ian would say, like, people put the cat's litter box next to the fridge and everyone keeps the cat's litter box in the kitchen, which is bizarre, but everyone does it anyway. So you probably are preparing your dog's raw food diet in the same place that you're preparing your own food and washing up. So the specific thing about the sort of dishwasher temperature was that when we were having the TB cases, so mycobacteria are they have this incredibly thick coat over them, which gives them, anyway, so you can freeze these things to really, really cold temperatures, and they will not die. They go dormant, and they just so routinely in the laboratory, I would keep clinical samples at -80 degrees. You can keep them like that for years, and people have grown TB out of bison from permafrost 3,000 years old, Egyptian mummies and stuff. Like, you can't kill this thing, but it's really not very heat stable. So the reason that we pasteurized milk was to get rid of TB from milk back in the 1930s. That's where it came from. And you actually don't need to heat it to very high temperature. 63 degrees will kill TB if it's at that temperature for not very long. So most domestic sort of dishwashers on a hot cycle will be hot enough to sort of kill even TB. So these things, they may survive being frozen and thawed, but the pathogens that like being cold do not like being hot, and vice versa. So like Ian was saying, the pathogens that like being at a human body temperature, like or a mammal body temperature, when you freeze them for long enough, they die because they can't cope with being cold. Well, equally, some of the pathogens that we're talking about can't survive being hot. So if you're cleaning up your own, area, kitchen, whatever, heat is your friend, as well as soap and stuff like that. But usually heat is the way forward. Like we wouldn't have had the TB issue with the venison if the venison had been cooked. So there could be TB, there could be dead TB in venison flavored kibble food all over the country, and we wouldn't know because it's been heated up and destroyed. So this is where you get this like sort of balance between this is where the freezing aspect of the sort of production process is sort of inadequate to do it, but heat is then usually your friend, as well as like appropriate disinfectants, kitchen cleaners used at the right concentrations and stuff like that. So yeah, and just being aware that if you're using a chopping board to cut blocks off your dog's raw food, that you then don't use the same chopping board to cook your veg that you're going to eat in your salad or whatever before because again, heat is your friend. So what you don't want to do is put the raw meat onto a chopping board or surface or something, and then or wash the dog's bowl in the sink in cold water, where these pathogens will live. Listeria, for example, will live in water, standing water, for a long time, and then wash your salad leaves that you're going to eat raw. That's where the cross contamination really happens. Sorry, that was a rant. That's a personal bugbear. I don't know if you got that idea or anything. Don't know if that came across.
No, if there are things that drive you nuts, then there are things that we probably should be thinking about, that they may not cross our minds all of the time, but this is definitely the time for it to be brought to mind. And if it's something that you are concerned about, then it's something that I'm definitely listening to. So if you've got any particular pet hate, I don't know if we can say that on such a webinar, but yeah, again, from our audience, if there's any questions that drive you nuts from your clients, any sticky ones, this is a very safe space. There's no question that's a daft one either, so please put them out there. We've got the benefit of Conor's knowledge this evening, and I'm certainly asking all the questions that I've written down on my sheet as well. So just added on that point, that sparked a question. So are there specific detergents or disinfectants that you would recommend, obviously with the use of hot water and being careful to separate any utensils, chopping boards, etc.? Is there anything specific on the detergent or disinfectant front that you would suggest?
So it's pretty much the same as what you would do if you were trying to safely handle raw meat in your own diet, so in the same way that you would, if you had a raw chicken, I keep going back to the raw chicken from Tesco's or Morrison's or whatever, treat it the same way, basically use the same methods and stuff. In practice, this is where it gets a little bit difficult, because if you have a hospitalized patient that's raw fed, and this is a bit of a contentious issue, and I might be opening a can of worms here, do you isolate that patient from other patients in your clinic or hospital? So I know that some practices have a policy where they do, and I know that some don't necessarily. But for example, you might have, and this is entirely theoretical, this has not happened, so don't panic, anybody. But for example, you might have a patient that's in your clinic for the day that's having a round of chemo or something and is immunocompromised, and in the kennel next to it is a dog that might be healthy, it might be in for something routine and elective like a spay or something, but is fed a raw diet. And because we know that they shed more, even without clinical signs, if that dog has a massive, has an accident in your kennel, is there the potential for cross-contamination to an immunocompromised patient? And that is, I think, a theoretical thing at the moment. in terms of TB, we have seen there was a case that happened where a lump was removed from a cat that turned out to be caused by TB, Mycobacterium bovis. So this is nothing to do with the way the cat was fed. This cat picked this up by hunting, and it was removed. But in the same day, 2 other cats that were kept in the same ward were neutered and spayed, so went ovarian hysterectomy, and both of them had developed abdominal septic TB because they were operated on and they were near to the cat. And yeah, so it can happen, like, you know, I mean, and this cat wasn't raw fed, so it's a bit of a, again, theoretical risk.
Yes.
But, you know, there are hypothetical situations you can think of where that might be a problem. So basically, we always used, in the TB lab, I always used Trigene or similar.
Okay.
I don't know if I'm allowed to say that, or Anagene, it's now called, I think. I don't know if I don't
Other
get paid.
disinfectants are available.
Yeah, I don't get paid by Anagene, so that's just what we used because it is mycobactericidal, and we would just use a higher concentration if we were worried. So most practices would, for general routine disinfection, would use about 1% solution. You could up that to 2 or 3% if you're worried, and that will kill with sufficient contact time of 20 minutes, half an hour. That will kill pretty much everything. There's nothing that's going to survive that. So that's what I used to do in the TB labs, to, you know, clean down from doing postmortems on cats that were tuberculous or dogs that were tuberculous. We'd just wash everything with 2 or 3% Anagene, and nothing survives that after half an hour.
Okay, and you're here to tell the tale. So,
I survived, yeah, but there was no, we didn't release TB out into Scotland, so we did that for 4 years. So I think we did quite a good job. It does do quite a good job.
Agreed. So I think to answer that question, then, that in your own or in your client's kitchen to use regular household disinfectants. I know certainly when the pandemic came along and we were all wiping our shopping before we put it in the cupboards, you know, that the disinfectant manufacturers then were very keen to stake their claims of how many viruses and bacteria their products would kill. So yeah. I think in your kitchen or in your client's kitchen, hot water and a proprietary disinfectant sounds like it's, you know, and good common sense hygiene is good. In your practice, if you're concerned, using your usual you know, isolation standard disinfectant, you know, that you're using the rest of the time, sounds like it's a good approach at the appropriate concentration and with the appropriate contact time as well. And just in response to your comments about how people are approaching raw fed cases, a couple of comments have come in as well, just to say that raw fed patients may be isolated and barrier nursed. So it's actually something, had it not come up already, was going to be a question to ask as well. So should there be concerns about, you know, mixing raw fed patients with you know, standard fed, kibble fed patients, if you like? And certainly, as you've pointed out, have you got a chemotherapy patient, an immunocompromised patient, you know, a neonate? It's certainly something that we can't offer you, you know, an SOP for those, but something that you should be bearing in mind in your practice, and putting into consideration some steps that you might take if that became a concern.
It's difficult. It's really difficult, and I definitely know, you know, there are practices and clinics and even big hospitals where they are so concerned that they will have, you know, they will yeah, like you say, put them in an isolation unit as if they were infectious.
Yeah,
that's a practice based. You know, every practice is gonna have to make their decision about that, but you know, equally, everyone's like terrified of being sued these days. So, yeah,
we're on the same page, Conor. I think that we can't dictate what any individual practice or person should do, but certainly it's something that we need to consider. You know, on a practice and personal level.
Yeah. Yeah, people should think about what they do with them and if they need to change what they do or not.
Indeed, and we were also made aware during the pandemic of you may have staff who are vulnerable also. So again, as part of your risk assessment around these processes, then something that's worth bearing in mind, going back to Conor's point about the ISFM guidelines, that any animal that's presented ill or indeed well, to make sure that you've got that full clinical history, so you've got an absolutely clear picture of what their background is. A further point that's come in, should we advise against mixing a raw food with a general wet or dry food? Should it be solely one or the other? What would your thoughts on that be, Conor?
I mean, I don't see any reason why you couldn't do that. I mean, I know clients that feed different brands of dry kibble, to make it more interesting for their dog, the same way that they might stick with a single brand but feed different flavors. Some people offer different brands, etc., whatever. So in theory, it would be the kind of same principle. It would come down to, it would probably, the biggest thing, and again, it's not something we're really into, is that the overall diet is balanced nutritionally. That's going to be the big question with that. So making sure that the overall diet is a nutritionally balanced one, it's going to be the challenge if you mix and match, but it doesn't mean it can't be done.
Sure. Okay. So look at the bigger picture then, I guess, around that. Ensure that the pet's fed on something that's appropriate for its size, life stage, etc. And if the owner is choosing to use a raw food, then take all of the hygiene precautions that we've discussed already. One of the points that you also alluded to during your presentation was around antimicrobial resistance, and HORIBA had a stand recently at the Vets Cymru event, which was the Congress of the Welsh BSAVA, and they had a plenary session and some discussion there about One Health and how they are approaching antimicrobial resistance in Wales. Obviously, touching back on the parasitic side of raw feeding, whether that's by choice or by pet scavenging. Ian did a really good presentation there about the parasitic risks of either choosing to raw feed or what your most likely dog might find in Wales. But it's a big issue for them as well around the antimicrobial resistance and what people are choosing to feed their pets. So thank you for raising that point as well. Again, it's something that we need to take into account with feeding. So I can see that we've got 5 minutes to go now until we're due to close. So this is your last opportunity. If you do have any questions, any points that you would like to make, then please pop them into the questions box on the dashboard just now. It remains for the moment, unless we get any more questions come in, to thank Conor very much indeed for his presentation this evening. He's been a joy to work with, and we've certainly benefited from the information that he shared this evening. As we've mentioned, the presentation will be available to view. You'll be sent an email to link to that if you want to watch it back, or if you know anybody who wasn't able to join us this evening to watch back. Anybody who's popped a note in the chat to request a CPD certificate, they'll be sent to the email address that you've given or the one that you registered with. If there are any questions that spring to mind after this evening, either for the HORIBA team or for Conor, and then we can get them forwarded on to him. He's a really helpful guy. I've certainly picked his brains about more than one thing before this evening's presentation started. So I don't think he'd have any objections to answering any other questions that might get raised. So we'll be very happy to send those on. You've got the HORIBA links there on the page in front of you, so you can contact us and contact Conor via those. And you're welcome, and please do follow us on our social media channels. Apologies, that's the dog.
You said he would do that. You said he would do that.
He's just expressing his thanks as well. He's going to be very careful what he scavenges now. And he's an absolute classic example of a dog who I do choose to feed him a kibble diet for convenience more than anything else. But he would very happily help himself to anything that's dead or out of anybody's bin bag, you know, that's on the pavement. We're not very rural where I live, but there's plenty of things that smell better than dry biscuits. So just being able to be aware of those hints around hygiene are very useful. So thank you to Conor. Thank you also to the HORIBA team who have helped to put this evening's webinar together and make it all go very smoothly.
But yeah, send any questions or anything. But yeah, infectious, and keep it infectious and medical. I don't want people sending me like X-rays of broken legs and stuff. Like, I've been able to see it. Don't do that. There's better people for that.
I can promise I won't do that. I don't know that any of our attendees this evening will either, but
yeah,
thank you for that. The HORIBA team will be at the BVA show in September in Liverpool. We'll also be at London Vet Show at the XL. So if you're visiting either of those events, please come and say hello. We'll have a pocket PCR analyzer on the stand if you want to come and have a look and see it in action. Are you attending London Vet Show, Conor? Will you be there?
I'm hoping to. Yeah, I've got to negotiate leave with my colleagues, so we'll see if we can. We'll have to draw lots to see who gets to go, basically.
Oh, okay.
Flip a coin.
Okay. Well, if we're able to meet you there in person, that would be lovely. But thank you again for this evening's presentation. For everybody that's tuned in after, I expect, a long day, or maybe even the start of a long night if you're working this evening. But we're very grateful that you've joined us. Please look out for the next HORIBA CPD coming up soon. You will also be sent a survey after the event has closed. If you would please just take a couple of minutes to fill that in and inform our future CPD, we'd be very grateful. We've had a really great number of people sign up and join us this evening, which is very rewarding for us. And we want to provide CPD that's useful and engaging for our customers and future customers. And we can only do that better if you let us know what you want to hear about. So to everybody that's watched, thank you very much for joining us. Thank you again to Conor, and enjoy the rest of your evening.